we have this rework of the labor pool that's happening. I would assume that's a very big conversation that's happening at a lot of health systems, like how we're going to take care of our staff is probably first and
Oh,
foremost.
sure.
I
Yeah,
mean,
and
they're
burnout.
burnout, they're just working like
Mhm,
crazy.
mhm.
And that's one of the things that struck me here. We're going to expand the clinic hours, and we're going to drive for higher productivity within our physicians. Seems to be at odds with hey, we've working these people like crazy over the last 2 years,
Mhm.
and we need to get our financials back. Therefore, we're going to put the burden back on the physicians. This is where I come back to the health IT conversation, because a lot of this will end up being things like, okay, how can we be more productive? What tools can we bring in to bear? How
Yeah,
can we engage the patients that have delayed care? How can we get more efficient with our scheduling to make sure there aren't open spots and those kind of, all those things that some there are tools and there are things around that we could be implementing. So I mean, how does health IT engage in those conversations, do you think?
so I think there's two threads here in terms of the discussion and the needs and where health IT engages. One is for the clinicians. What can we do to make their lives easier, to make their work more efficient in terms of the systems that they have, that they're using? And we all know that, what do people say? No physician likes their EHR. There's many complaints, and it's a contributing factor to burnout. But what small things can we do to make it easier, more efficient for them? One of the things at Boston Children's Hospital, through the innovation group and John Brownstein's leadership, he's the chief innovation officer, they do a twice a year call for pain points to employees. Where are the pain points in your work? And then that is summarized and worked in terms of what new things do we need to be able to do to provide for them, and what things do we need to be tweaking. If you look at the patient side, patient engagement, how can we make that journey easier for them? And that's a lot of leveraging your core vendors. It's a lot of add-ons where the gaps exist, and really focus on that digital front door as we talk about, and making it easier and more accessible to our patients. So those are two of the threads I think that IT leaders are definitely get involved in those discussions. And the question about culture and burnout, IT is not just serving the organization, IT also has a staff, right?
Right.
So are my people at Boston Children's burnt out? What do we need to do for Zoom fatigue and the long days? And how do we address their issues as workers as well?